Cataracts are more common as you get older. By age 65, about 30% of Americans have some vision impairment from cataracts in one or both eyes. By age 80, over 50% have cataracts. Cataract surgery is currently the only effective treatment to restore your sight. The good news for Medicare patients is that Medicare covers cataract surgery. Hi, I'm Danielle Roberts, co-founder of Boomer Benefits and author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make. In this video, I'll give you a quick overview of how Medicare covers cataract surgery. So, how is cataract surgery performed? Most of the time, cataract surgery is an outpatient procedure that falls under Medicare Part B. You'll most likely be awake during the surgery, but your doctor may give you some medication to help you relax. During cataract surgery, your doctor removes the clouded lens and replaces it with an artificial implant. There are two methods for removing the clouded lens. In this first type of surgery, the surgeon inserts a tiny probe into the lens and uses ultrasound waves to break up the cataract. He then vacuums out the particles and places the artificial lens over the lens capsule. The incision in your cornea is very small. You may or may not need stitches to close it up. If you aren't a good candidate for the first type of surgery, your doctor will make an incision in the cornea and lift out the lens in one piece before placing the lens implant. Because the incision is larger in this extracapsular procedure, you'll definitely need stitches in your cornea. Although there may be itching or mild discomfort after a cataract surgery, you should see improvement in your vision within a few days. You may need to wear an eye patch for a while after the cataract surgery and use special eye drops to prevent infection and keep your eye pressure under control. Sometimes the doctor can inject these medications during surgery, so you won't have to use eye drops, which fall under Medicare Part D. Cataract surgery is successful for the vast majority of people. A small number of people go on to develop a second cataract in the treated eye, but it won't require a second surgery. These post-surgical cataracts are treated with a special laser right in the doctor's office, and the procedure takes about 5 minutes. The total cost of cataract surgery will vary based on what type of intraocular lens your doctor uses, whether the doctor uses a laser during the procedure, and whether your cataract surgery is done in the hospital or an outpatient surgery center. It's important to talk over your choice of intraocular lens before you have cataract surgery with Original Medicare. Medicare covers the cost of a monofocal lens, but your doctor may suggest a premium intraocular lens if you have astigmatism or farsightedness. If you choose one of these premium lenses, expect to pay more out of pocket for the upgrade. If you have Original Medicare Parts A and B, then Part B covers the cost of the outpatient surgery center, doctor's fees, and other associated expenses with outpatient surgery. The Part B deductible applies if you haven't yet satisfied that deductible in the current calendar year, and then Medicare pays 80% of the allowable charges. While in most cases there is no hospital stay for cataract surgery, if you do need to be admitted to the hospital, then this would fall under Part A. You could pay a separate Part A deductible if your cataract surgery requires an inpatient stay overnight, which is rare. Part D pays for any drops or medications your doctor prescribes before and after your cataract surgery, and you will pay any copay or coinsurance for this as outlined by your plan. And if you have a Medicare Advantage plan instead of Original Medicare, your plan will pay based on the schedule of services listed in your plan's summary of benefits. If you have a Medigap plan to go alongside your Original Medicare Part A and B, your plan covers its share of any costs for services approved by Medicare. For example, your plan will pay the surgeon and facility charges, but it won't pay any portion of your upgraded lenses, if you choose one, because it's not an item covered by Medicare. Medicare Advantage, on the other hand, is private health insurance, so each plan treats cataract surgery differently. Many pay most of the allowable charges, leaving just an outpatient surgery copayment for you. You may also have an annual deductible for your Medicare Advantage plan. If you have Medicare Advantage, your plan may or may not pay some of the costs if you choose to upgrade to an intraocular lens. Talk it over with your doctor and contact your plan for an estimate if your doctor recommends a premium lens. That way, you'll avoid any unpleasant surprises with your bill. Cataract surgery is one of the most commonly performed procedures for Medicare patients. It's generally considered a safe and effective treatment. Medicare covers quite a bit of your costs, but it doesn't cover everything, especially if you choose a premium intraocular lens. If you have questions about your Medicare coverage and cataract surgery, a Medicare expert at Boomer Benefits can help you compare plans to see which plans you may be eligible for that would best suit you. I also recommend watching our Medicare Advantage versus Medicare Supplement video here on YouTube. Thanks for watching, and we'll see you in the next video.